Hi there, and welcome to my podcast for patients. This is What is COPD Success? Who is Kelly Welton? And let's talk about what actually goes on in a pulmonary rehab program. So, I am Kelly Welton. I have 32 years of experience as a respiratory therapist. I've taught in several pulmonary rehab programs, and I really love pulmonary rehab, but I didn't like the fact that I had to turn away so many people because either my class was full or the patient couldn't go. So I built COPD Success for people who can't make it, whatever the reason is. It's too far, the copay is too much, whatever the reason is. I built this for people who can't make it to a live program. So that's what I figured. Why don't I bring pulmonary rehab to people who can't come? So I have two different programs to choose from. I have 30 Days to Breathing Easier, which is an email only program. So people who aren't real internet savvy, but they know how to work an email. It's an email every day that drops into their inbox. They just click on to open. They don't have to log in anywhere or do anything. Or my big program, which I call COPD Success. 22 online learning modules, stretch and warm up video to follow along. There's an exercise workbook and progress workbook for them. A lot of fun. I also did a webinar for parents of kids with asthma, just in case anyone was interested. I think it's good information for COPD patients as well. So what exactly is pulmonary rehab? What goes on in pulmonary rehab? Well, your doctor probably referred you, but more than likely, your doctor can't tell you what we do in pulmonary rehab. All he can tell you, or she, all they can tell you is they do really good stuff in pulmonary rehab. Yeah, they do really good stuff. So exactly what we do is 6 weeks or 8 weeks, depending on the program, of exercise and education. So the American Association of Cardiovascular Pulmonary Rehab sets the agenda for the topics that we usually talk about. These are proven methods that we use to lessen the effects of COPD. We can't cure COPD, we can't reverse it, but we can lessen the breathlessness and lessen the effects. We can help you build strength, build flexibility, and build endurance. And in a formal rehab, a live program, we do what's called the Big Four, which is the bike, a stationary bike, a treadmill, something called an arm bike, which is like a bike only you do it with your arms, and do free weights. And then we ask our patients to walk a little bit on the days in between. A typical program is a Monday, Wednesday, Friday. And what happens in a live program is gradually we progress the exercise intensity and the duration. So for example, we may start you on the treadmill at 2 minutes. Then we see if you can go 2.5 minutes. And then we'll see if you can go 3 minutes. And then maybe we'll keep you at 3 minutes, but see if you can go a little bit faster. And we kind of stair step the progress. Another thing that we do is we optimize your medications. A lot of education goes on. So I find a lot of patients are on medications. They have no idea what they're taking, how they work, what they do. They're often on duplicate, even triplicate medications, or they're on medications that antagonize each other, cancel each other out. We do a lot of education about oxygen. And in general, just taking better control of your symptoms and your life. And in doing all that, you will wind up with less hospitalizations, less readmissions. So again, oxygen, we talk a lot about. It's very important to protect your heart. So I may have patients who are on oxygen, or I'm sorry, patients who are not on oxygen, and when they come to pulmonary rehab and start moving around, we discover that they do need a little bit of oxygen, but it's almost never permanent, which is a good thing. So what will you actually do in rehab? Well, whether you do it in a formal live pulmonary rehab program or if you do it in COPD Success, we start with a 6-minute walk test. And that kind of sets the baseline. That determines your speed and your duration on the treadmill. So if you're going to do COPD Success, my program, and you don't have a treadmill, don't worry. We're going to determine how far you can walk. We determine your safe heart zone. What's the maximum heart rate that's good for you, and adjusted for medications. Some people are on heart medications that artificially lower or sometimes elevate the heart rate. So we can't just do the standard equation. We want to find out what's a good heart rate zone for you. And we want to find out How much exercise do you do and what happens when you do it? So it could be a number of things. Maybe you get breathless. Maybe you just get very tired. Maybe you desaturate. Maybe you don't. Maybe you start having a lot of pain somewhere. So how much exercise do you routinely do? What happens when you do it? And how can we adjust that so that you get the benefit of exercise? We'll talk about breathing techniques with exercise and with your activities of daily living and at rest. Number one, though, in the COPD Success Program, your safety is my absolute first priority. Make sure that you're doing this safely, either with somebody knows you're exercising, and you're monitoring yourself. You will learn how to monitor yourself. So who should go to a pulmonary rehab program? Who's a good candidate? So anybody who's determined, they've got the mindset, I want to get better, I want to feel better. The exercises and the breathing techniques that we use in COPD Success have also been shown to help people with interstitial lung disease, pulmonary hypertension, and pulmonary fibrosis patients. If you've got something called PVOD, which is pulmonary veno-occlusive disease, we will ask that you not do the exercises and the breathing in this program. You really need to see a specialist. If your weight is greater than 250 pounds, we would probably ask you to try a weight loss regimen first before you try doing anything in a formal rehab program or a formal walking program. Other good candidates are you're just tired of being tethered to your nebulizer and you're motivated. You want to have a couple of extra years to be able to spend with your kids or your grandkids, motivated to get better and get out and do more. And what about oxygen? So if you're not on oxygen and you feel short of breath, you might need it because of your increased activity. You may not. You just may need some breathing exercises. If you're on oxygen and you're very active, we may need to increase your oxygen to fuel you a little bit better, and ultimately you will level off. There's a lot of things we talk about, the physical need for oxygen and the physiological need for oxygen, as well as social and personal issues that go on with oxygen. So a lot of patients who get referred ask me, why do I need to do this at all? I've had COPD for a long time. What are you going to tell me? There's nothing new to learn, right? So I want you to go to thebreathingspecialist.com, www.thebreathingspecialist.com. For one thing, you get up-to-date, reliable, free blog articles in there, because I don't want you to rely on the internet and rely on spun internet sites. And what I mean by that is you go to some place that you look up something about COPD or emphysema, you end up on a site that has what I call spun content, which is an article here written by somebody who has no medical knowledge whatsoever. They just took another article, changed the wording around a little bit, and it's all about the advertising. All of these things right here are ads. These sites are just designed to get your name and your email address so they can bother you with all kinds of stuff that's for sale. So don't do that. Just come to the breathing specialist and get some reliable information. So what are the topics presented in COPD Success? Again, back to the question, why do you need to do this at all? I talk about safety, I talk about your physical safety, I talk about your physiological safety, which is exercising in a safe zone for you with your heart rate and your saturation. Living well with COPD, it's not easy to live with COPD, so what can you do to make the best of it? I talk about advanced directives. I've got nutrition guidelines for you. I've got 22 modules all together, and I've got more coming. So, and these 22 modules, again, in COPD Success, you can look them over whenever you want, as many times as you want to or need to, in any order that you want. I recommend going from one on and doing them in order, but if you want to see something again and again, or you want to see something first, absolutely go for it. So if you have any questions, I just want to close and say, can online pulmonary rehab really be effective? Exercise is half of the equation, but education really is the other half. And so if you're not able to attend a formal pulmonary rehab and your only exercise you're doing is just walking, that's fine. Again, you will learn a lot from the educational modules, even if you're not doing the big four exercises. So visit thebreathingspecialist.com. When you go there, a little box will call up a Visita box right here, and you can get in touch with me and make an appointment, and I have free 15-minute consultations for you. We can talk about it. So Thank you for joining, and I hope to see you on the website.